Eckstein here at the Animal Specialty Group in Los Angeles, California, one of the top specialty veterinary hospitals in all the country. But you know, a lot of people are unaware that veterinary specialty hospitals exist. So what I'd like to do is take you on a tour. So follow me.
Then we don't have to get crazy about the total housing.
I'm gonna say yeah.
Oh wait, Charlie Allen, I know him.
Dana,
I got an idea.
I don't know who you want me to ask. I'm going to ask exactly what specialties are here. People got to know that.
She just mentioned that. And there's her word for it. Yeah.
Here we are at the Animal Specialty Group. I'm with Dr. Stephen Bilbrey, who's a surgeon here. First of all, Dr. Bilbrey, what is a specialty hospital? I mean, why is there a need for specialty hospital? How does it differ from just going to your regular veterinarian?
Okay, the veterinarians in specialty hospitals have training above and beyond what most veterinarians have. So most vets will practice right out of school. Specialists in their chosen field will go on for approximately 4 years after veterinary school.
So really it's no different than a human doctor after they graduate medical school?
That's essentially true. We have to do an internship and then a residency. And then after the residency, in order to become board certified, which the specialists at this practice are, you have to pass a rigorous examination and you have to publish in refereed journals.
Just kind of like going for a doctorate.
Well, it's almost like a double doctorate. Yeah, that's true.
And when you were going to vet school, what school did you go to, by the way?
Colorado State.
Colorado State. When you went to vet school, what made you decide? Did you know right away that surgery was for me, or were you just going into general practice and decided after a while that maybe surgery was the way to go?
I think for me, like many people, you're influenced by some of the mentors that you encounter during school. So there are a number of surgeons at Colorado State who are world-class surgeons, and there's one in particular who is also an oncologic surgeon who kind of encouraged me and kind of pushed me in that direction. So I developed a real interest in it, and that's the way I ended up. So I have a real interest in cancer surgery.
Really? So in other words, if someone were to go to their regular veterinarian, let's say that the vet diagnosis a malignant lump or tumor or whatever on the
right.
This is a tough question for you, and I don't like to be tough, but the bottom line is, are they better off going to a surgeon that specializes? I would assume, yes. I mean, if there was some lump on me, I'm not going to my intern, I'm going to a surgeon that specializes in oncological medicine.
And it's just like in human medicine, it would be similar to you seeing your family doctor. Your family doctor helps to make the diagnosis, but your family doctor is not really equipped, both in terms of training and specialized equipment and things like that, to do a definitive surgery on that patient. And so the specialist has additional training which helps them to understand, say for example, tumor biology better, the different kinds of tumors, how they're treated, what the options are, and how best to treat that patient. And they also have advanced skills in surgery in terms of reconstruction and everything else. And these are things that, even though there may be very, very good general practitioners out there, they don't have that same set of skills.
This is what you're doing day in and day out. So you're
Day in and
focused
day
on it
out.
consistently.
That's right. I don't do any routine surgery. All of my surgeries are advanced types of surgeries.
So a lot of oncology surgeries.
A lot of oncology.
What about cancer? I mean, I've been doing this for a lot of years, well over 30. I just look at it, Doc. The bottom line is, what really is increased? I'm hearing a lot more cancer than I've ever heard before. Is it environmental issues? Is it the food we're feeding? I mean, every day you hear about a new recall
Sure.
that's going on.
Sure.
What do you think the cause primarily is?
I think all of those factors become important, but I think also one of the biggest factors is an increased recognition. So as specialty people, we are diagnosing more and more different kinds of cancers. So it almost seems like maybe there are more out there. I think it's always been there, but then we have to look at everything else, the environment, the food we eat, all of those factors. We're understanding so much more about heredity and the influence of that on the development of cancer as well.
I've been hearing a lot lately about melanoma, skin cancer in dogs, which years ago you heard very little about. Are you seeing that a lot?
Melanoma in the dog is a little bit different than it is in people. Most of the melanomas that we encounter in the skin of dogs is usually benign. It's melanoma in the mouth, the oral cavity, that is usually highly malignant. And
Would that affect the nose as well?
it can, but very commonly it's in the mouth. Sometimes we'll see it in the toes, the nail beds, things like that. But the ones in the skin, even though we do see malignant melanoma in the skin, we don't see it nearly as much as in people. And we do know in people exposure to sun, damage to the DNA from the sun can lead to those kinds of cancers.
Here's a question I always get on the radio show. It's always about spaying and neutering.
Okay,
And from a spaying and neutering perspective, obviously I'm a proponent of it.
sure.
But the bottom line is this: people just assume it's strictly for moral reasons. They have no comprehension that's a physical priority to have your pet spayed and neutered. Agree with that?
There are excellent reasons to have your pet spayed and neutered beyond just the reproductive aspects of it. Just as an example, let's take male dogs. There's a much higher incidence of testicular cancer in older intact male dogs, obviously because they're still intact. Prostate disease is a huge issue too. Older male dogs that are intact are very susceptible to infections of the prostate. And in terms of female dogs, if you spay a female dog before their first heat, the incidence of breast
That's what
cancer
I'm hearing, yeah.
or mammary cancer is less than something like 0.25%. But if you spay that dog at 2 years of age, the incidence of breast cancer is like 27%. So it's huge.
So besides the moral reason, there's a physiological reason to do it
Absolutely.
as well.
And older intact females are predisposed to uterine infections.
Just
and
spay
things
and
like
neuter.
that.
Just the answer.
Yeah,
Just do it.
absolutely.
One important question to me is that a lot of people say, I've been going to my doctor for, let's say, a year, and I'm not getting the results. Everything's staying the same. At what point, I always joke about veterinarians, they're a useful tool like a wheelbarrow, but you got to push them once in a while. At what point does the client say to the doctor, listen, doc, maybe a specialist should be seen at that point?
Sure.
If the doctor doesn't push for it at first.
I think you have to be an advocate for your pet just like you're an advocate for yourself. So if you are concerned that things aren't progressing the way you would like to, it's your right to always seek a second opinion. And as a matter of courtesy, I think it's appropriate that you ask your veterinarian, I just have some more concerns. Would you have any objection to referring me to a specialist such as an internist or an oncologist or something?
Or a dermatologist.
Or
I hear this all the
dermatologist,
time, yeah.
so I can get another opinion on this. I'm very concerned about my dog. And then it's the job of the specialist to work with the referring veterinarian, to communicate with the referring veterinarian so that everybody's on the same page, everybody knows what's going on. So if we can determine what's going on with that pet, then the ongoing care may be provided by the regular veterinarian.
That's my final question, I promise. From the standpoint of a dog responding to therapy, chemotherapy, radiation therapy, is there a pretty decent response?
I think you will find that it's very similar to that in people. The cancers that we see in animals are almost exactly the cancers that we see in people in many instances. There are obviously some few exceptions. It's just that everything is compressed in terms of time. Animal cancers will respond to chemo and radiation almost the exact same way that human cancers are. And there are some cancers that we see in the dog. For example, bone cancer, osteosarcoma, that is almost the exact same disease in people. And some of the strides that have been made in bone cancer treatment in children is a result of the research that's been done in dogs, especially limb sparing. So saving the limbs of young kids that have bone cancer, a lot of that work came from work in dogs.
Interesting. It's an amazing field. It just amazes me to this day that so many people are unaware of the concept of going to a specialist in the veterinary field. They do it for their own family. And I always say, you can't say this, but I do. If you're going to a veterinarian and you're going there for a long period of time and you're not getting the results and you say, Doc, should we get a second opinion? And the doc says, no, you don't need it. I'd think about changing your veterinarian, because sometimes if the vet doesn't want you to get a second opinion, that's not the kind of doctor. I want my doctor to work with me and try to get whatever I can, get to whoever I need to get to save my pet's life. So next time you're with your dog or cat, ask your vet if there's a specific problem. Is it time to see a specialist? I think that's something every pet guardian should know. Here I am in Animal Specialty Group with Dr. Justin Wakayama, who's an intern here and specializing in internal medicine. Before we get to that though, Justin, can I call you Justin?
Absolutely.
What made you decide that veterinary medicine was you? Did you grow up with animals all your life, always have an affinity towards them?
Mm-hmm. Yeah, I always had pets when I grew up. Honestly, I've never owned a dog, still
Really?
never owned a dog, had cats and rabbits.
You don't own them, they own you, just so.
Exactly, but no, I've just had pets, here and there. Always liked animals, always, liked being around them, like working with them. Went to UC Davis for my undergrad, worked a little bit at the teaching hospital there. That's when I really started to like it. I volunteered there, got experience, and then I kind of applied to veterinary school, and that's kind of how it started.
And that's how it all started.
Yeah,
and now you went to veterinary school for how many years?
4 years.
4 years of veterinary school.
Mm-hmm.
Now you're interning.
And now I'm doing my second internship.
Second internship.
Mm-hmm.
The internship lasts how long?
So an internship typically lasts 1 year.
So the average person says to me, well, being a veterinarian, you go to college for 4 years, you go to vet school for 4 years, you graduate, you're a doctor, and that's the end of it. There's a lot more to it than just graduating school.
Definitely. I think especially if you want to specialize in something like internal medicine or surgery, there's a long road after graduation.
Speaking of specializing, how difficult it is for you to become a specialist nowadays in the veterinary field?
It's pretty difficult. There are only a few residencies across the country, just like veterinary school. The number of spots is limited, so it becomes more and more competitive every year. There's a lot of applicants.
Internal medicine, you hear that. I specialize in internal medicine. Now, from the layman's point of view, that means you look at my stomach and you look at my lungs, things you can't see on the outside. How would you define internal medicine? And as a specialty, what does it encompass?
So internal medicine is just a more in-depth approach to medicine. I think a lot of people who graduate veterinary school and then go out into practice who become what we call general practitioners, and again, nothing against being a general practitioner, they're very good at what they do, but they're more of a place where they're going to do wellness checks, they're going to make sure your dog or cat's healthy, they're going to do routine blood work, routine fecal screens, things like that, and they're going to tell you if your dog's sick or not. When they are sick, there's some things that they can treat, but then there are some illnesses that require more specialized training to treat, diabetes, Cushing's disease, things like that, things that may require like a specialist's touch.
So in internal medicine, if someone's dog does have diabetes, then you would be the one that they would speak to in terms of the dosage of insulin and what type of insulin and all that stuff.
Typically, some diabetics can be managed very well with general practitioners, but sometimes these diabetics become insulin resistant or have concurrent diseases like Cushing's disease or
Are there
other
times that
kinds of
certain
things.
insulins don't work with certain dogs or cats and you have to change?
Sometimes you have to change different types of insulin, that does happen, but typically, again, the cats are on glargine and dogs are on another kind of insulin.
So in internal medicine, let's say that someone is going to their general practitioner and they're working with them, but the general practitioner says, you know what, maybe we should get a second opinion from an internist. That's where you come into play.
Exactly.
So they would send their dog now to Animal Specialty Group, and then you would come in and you would evaluate, and then you would work closely with their general practitioner to come up with a plan that works for everybody.
Absolutely. We're very, very good at keeping in touch with the general practitioners, the referring veterinarians. We write them emails when the patients come in every single time. We also send them discharges. We also try to help, also kind of educate them as well to help them, make them better doctors as well.
Now you're relatively, from the amount of years I've been doing this, you're relatively a youngster. So my question to you is this. Probably if there was one complaint that I hear from my listeners around the country in Canada about veterinarians is, you know what, he's a great doctor and I love him. I just wish he had more personality. And I know that sounds crazy to people, but when people come in with their dog or their cat, they're stressed out. There's no more anxiety for a person to bringing their dog or cat to a veterinary hospital. So my question to you is part of your education, part of what you need to do is, besides caring for the pet, is kind of getting the person on board as well and motivating them.
Definitely, I think it's important. We have to work with the clients or the humans, who bring the pets in. Without them, the dogs don't walk themselves in the door. So we try to have a personal relationship, with the owners as well. I think every veterinarian has a different style. Some veterinarians are more to the point, more about coming in, treating the dog, and other veterinarians, some do it more, into forming personal relationships with the clients, a little more hands-on. Some clients do need a little bit more personal attention, And I think different veterinarians have different styles, different approaches.
As long as you make the person feel comfortable, that's what it's all about.
As long as we're working together to do what's best for the dog, I think that's
okay.
important.
So Justin, here's the big question. Okay, you're doing your second internship.
Mm-hmm.
The first internship was how long?
1 year.
So it's 8 years in school. 9 years. This internship's a year.
This internship's a year.
So that's 2 years. That's 10 years.
That's 10 years. Mm-hmm.
And the residency?
Another 3 years.
3 years. So that's 13 years before
Correct.
you actually. I mean, you're practicing now.
Right.
But before you actually are what?
Have my own specialty. Yeah, exactly.
And then you become board certified.
Board certified
in
specialist in internal medicine. Correct.
You're really looking forward to that?
I am looking forward to
So
it.
has it been worth all of the schooling, all of the effort to get to this point?
Definitely. I think the profession is very rewarding.
Is it a job or is it a passion?
It's both. I mean, it's a passion. I love doing it. It's also a job, though. I mean, we're here 12, 13 hours a day.
Especially at a hospital, specialty hospital like this where there's something going on 24/7.
Definitely.
Appreciate it, Justin. Thanks an awful lot.
Thank you.
I'm here with Dr. Michaela Collins, the Animal Specialty Group in Los Angeles. And Dr. Collins, first of all, what made you decide to become a veterinarian?
I think it's just something that I've always wanted to do. As a young child, I think I've always loved animals. I only had one cat when I was growing up, but I was
Were you the
totally
proverbial
enthralled
little
by
girl
her.
though, with like if you found a lizard or snake?
Oh,
in the backyard,
absolutely.
you-
I was bringing home all sorts of stray animals, hiding them in my closet, that sort of thing.
And when you decided, let's see, you made this great decision, I want to be a veterinarian, did you realize how difficult the road it was going to be?
I did not at first, actually. Not until I started working for another veterinarian when I was in high school. Kind of talking to him, speaking to him about what was involved, and I think a lot of people are surprised to find that there's a lot of school involved.
We were just talking about that. We were talking to an intern before, and I imagine it's the same thing for you. It's 4 years of regular college,
Correct.
4 years of veterinary school,
Yep.
which is tough enough to get into to begin with. And after veterinary school, a year of internship, or more than 1 year of internship,
I
and then
did.
residency. So it's like a lot of years before you say, you know what, I can afford to buy some milk.
Absolutely. Definitely, I don't think we're getting into it for, that instant gratification. I think this is a career choice
It is a career
that
choice.
You have to be really passionate about what you're doing, and yeah.
So you become a veterinarian and you graduate school, and a lot of veterinarians after 8 years they can pretty much go into their own practice if they want to. You decided to go a little bit further and become a specialist, and I'm a big fan of specialty hospitals, obviously that's why I'm here. What made you decide on a specialty, and internal medicine is your specialty, and what made you decide on internal medicine?
I think I really like the relationships that you're able to create with both the owners and the patients, because a lot of these animals do have chronic problems, and so I'm able to meet with these owners over and over again and really create a relationship and get to know them and get to know their pet.
That's important to me. So you're able to adapt to, for example, the hyperactive client versus the more laid-back client versus the client that's going to come here in tears, or the client that's going to grill you for every bit of information. You have to adjust accordingly.
Yeah, I think we have a large spectrum on different people and owners and that sort of thing. Absolutely.
Now, in terms of internal medicine, let's say the average person goes to their general practitioner. At what point does the general practitioner say, you know what, maybe you should see an internist?
Let's see. I think it would really depend on the disease, but I think when we're starting to require diagnostics that are beyond what they can offer. So maybe that patient needs an abdominal ultrasound. Maybe that patient needs an endoscopy. I think some of those are some of the big things that we get patients referred.
We were walking around here before, and I said to myself, wow, I wish my hospital had the equipment you guys, MRIs and scans and this and that and this. Really makes a big difference in terms of being able to diagnose, as you said. And I guess diagnosis is more important than anything else.
I think very much so. There's definitely some limitations as far as what many general practitioners can do. I mean, they've got access to a lot of different blood work and things like that, but I think one of the major advantages of the specialty hospital is the equipment we have.
So what disease at what point and what disease would a general practitioner say, you know what, it's time maybe we see specialists? And what happens to the person who says to their doctor, you know what, doc, we've been treating this for a while, it's not getting any better, we should see a specialist? What if the doctor says no? What if their vet doesn't want you to see a specialist?
Well, I think that they could potentially seek a second opinion from another general practitioner. I feel like these days most general practitioners are willing, and if that concern is voiced, they're very open to it. Yeah, I do feel that way.
As an internist, what do you think the most common, I know it's a wide array, but the most common type of ailments you're going to see as a specialist in internal medicine?
I would say a lot of chronic gastrointestinal disorders, so chronic diarrhea and vomiting. Also chronic respiratory disorders. Dogs get bronchitis, cats get asthma. Those would be two big ones. We also see a number of different endocrine diseases, diabetes, Cushing's. So those would be high on the list.
Would you be handling, I mean, dogs really don't get rheumatoid arthritis, but would arthritis be something besides the orthopedist from an internist point of view that you'd be working on?
Absolutely. I would say we see a type of arthritis called immune-mediated polyarthritis, which is in a sense kind of like a lupus. So that is.
I have
something
rheumatoid arthritis, so I'm very familiar with the immune deficiency aspect.
Yeah, so we actually do have a similar syndrome in animals. It's not exactly rheumatoid, but it is an immune-mediated process, and we will see a lot of that.
Is it treated where the client has to give the dog or cat a vaccine weekly, or they come in here for that?
No, we're using a lot more oral immunosuppressive therapy, so a lot of prednisone, cyclosporin, the other medications like that. So.
Now you said something that was real important. I studied at the University of Frankfurt animal behavior for many, many years. And I'm a firm believer that when you're working with anything that's alive, it's got to be a passion. Absolutely. I mean, you got to eat a lot of rice and a lot of beans for a lot of years, and then eventually say, you know what, this is really where I want it. When I first told my parents I was going to be an animal behaviorist, there was no one doing it at the time, so they said to me, are you crazy? Are you nuts? They tried to get me into therapy real quick. But now everywhere you turn, there are more animal therapists and even veterinary animal therapists out there. Yeah. So the whole concept of specialty maybe is because, years ago when I was growing up, every dog in America was Duke, Queenie, Blackie. Now it's Sam, Harry, Saul. Sounds like a poker game on a Friday night. Yeah. And I think people just are accepting the fact that their dog or cat is no longer the family pet, but it's actually part of the family. And literally, I mean, I have listeners that call me up that go into debt, mortgage their houses, but they would do it for any member of the family, and if that's just important. Do you find that?
Absolutely. I think that's a huge proportion of the type of clients that we see here. Really, they consider their pets a part of the family, and that's why they're here, because, as you said, they would do whatever it took for those family members.
So how would you describe the fact that we're so lucky here in Southern California to have an animal specialty group? I mean, there are animal specialty groups or animal specialty hospitals in other states and other parts of the country. Sure. But what about places where people can't get to it? We're very lucky to have it here, aren't we?
Yeah, absolutely. I'm actually from Central California, and I would say, there's not a lot of specialty hospitals that are immediately accessible to them. I mean, they just have to drive a little bit, maybe to Fresno, maybe to Davis, something like that. And I think we're very lucky because, I've talked to friends and family who that's hard to have to drive that distance if you have a doctor that you need to meet with frequently for a chronic problem or that sort of thing.
One of the things I found about animal specialty group that really impresses me, I go to a lot of veterinary hospitals around the country, is number one, the most difficult part for a client is when they first walk into the animal hospital. Yeah. If the receptionist is sitting there and they don't have a smile on their face and they're not happy and that dog's barking over there and this cat's meowing over there, you have such an ability here. Just everyone's sitting out there comfortably, relaxed, and everyone's smiling. Yeah. Do you find that makes a difference in terms of helping you relate your information to the person?
Oh, absolutely. I think that initial impression and feeling comfortable here is a huge part of their experience. Just that first impression.
Well, I'm so glad to make. But here's the final question. I promise this is the last one.
No problem.
If you had to do it all over again,
Okay.
All the expenses, all the schooling, all the studying, all the late nights, would you do it again?
Absolutely.
No doubt
100%. No doubt in my mind.
Pleasure meeting you. Thanks for coming in.
You're very welcome.
Here I am at the Animal Specialty Group with Dr. Kirk Wendelberg. Good to see you again. Good to be here.
See you.
Specialty Hospital. This is your office, by the way. I love this office because I know how hard you work just by looking, because it looks like mine. But the bottom line is this. Why a specialty hospital? What's the difference between a specialty hospital and what's the necessity for a specialty hospital?
Well, general practice does everything, and I got into this just because I was a surgeon and I couldn't do everything. I needed internist, a neurologist, now a physical therapist, and we can't do everything the best. We've got to start narrowing everything, our fields down to where we can do a good job.
So when you realized you weren't omnipotent anymore, the conclusion said, well, maybe I need a neurologist and an internal medicine guy. Does it make it a lot easier? I know you work primarily on referral from regular veterinarians, but does it make it a lot easier when you have those specialists all in one location? So if you're doing surgery and a neurological problem comes up, you can call a neurologist.
Oh yeah, absolutely. What we've got is just a great situation for me and for all the other doctors. Just because of that, we can go to our radiologist, you know, on a dime and say, take a look at this. And
how does that relate? Let's say, you know, you take the average person who's going to their general practitioner is now saying, it's beyond my general practitioner's expertise. Not anything against the general practitioner, but let's face it, everybody has their own specialty. So at what point should they say, or do they say to their general practitioner, you know, I'm just not seeing results. Maybe a second opinion from a specialist is warranted. Is there a point where they reach, or is it if they're not seeing results, do they get to that point?
Everyone's different, and you know, all the general practitioners are different as far as how they handle that. Some will immediately go, I know what's going on here. It's out of my league. I don't do that. I'm better at other stuff, so I'm gonna send it. Whereas others will, you know, try to get into it more and find things aren't going the right direction, then refer it. So everyone's different.
It just kind of makes common sense though with the family pet, which is like any other member of the family nowadays, that if there's something better, I don't want to use the word better, but if there's someone who's more experienced or more knowledgeable about a specific problem, whether it be orthopedics, neurology, whatever it is, aren't you better off at least getting that person to look at the pet? So even if they can't do anything, at least you have that clarity in your head.
Sure, in some situations. I think there's so much out there that general practitioners can do very, very well. And they take a problem, they get a diagnosis, they know what to do and feel confident in what they're doing. And that's all great.
So it's when
but
they
there
have
are
that question.
There are times where, you know, you look at it and you go, I'm not really sure what's going on. Or you look at it and go, I know what's going on, but I don't do those. You know, it's a tough problem. And those are times to refer.
So as a surgeon, for example, if my dog needed surgery, I would probably want to go to some specific type of surgery. I would want to go to someone who does surgery all day long. It would just make me feel more. I would do it for myself.
And there are people that are like that, and they do want to go to someone that's boarded. In many cases, it's a good idea, but sometimes the general practitioners can do a good bit of surgery, neurology, but there are things that are over their heads.
So from your perspective as a veterinarian, the ideal scenario would be the general practitioner working in conjunction with the specialist here at ASJ.
Yeah, work together. And just like we work together here, if there's something that I can't do as well as someone else, or where I need some help, you know, just
and don't be afraid to ask.
Go right to it. Yeah.
All right. So you started this hospital how many years ago?
Back in 1990.
1990.
Yeah, so 12 or 22 years ago.
Wow, time flies. Huh?
Yeah.
22 years ago. Did you have the idea it was going to grow into what it is?
I had the dream.
I was just going to say the dream.
I had the
there.
dream.
And how many different specialties are here now?
Oh my goodness, I think there's 7. Is that right? 7?
7 different specialties. So that would be like oncology,
neurology, radiology, internal medicine, surgery, critical care,
physical rehabilitation. See, that impressed me. That's what sent me here first. When I found out that you had a veterinarian here that specialized in physical rehabilitation, because there are people out there that do human physical therapy that think they know the dog and know the cat and they can practice on the dog or cat. And I tell them, you know, dog or cat doesn't have the same skill and little thing that you have. So I was so impressed with your vet that specializes in, and I was just down there. Do you have a tub where they can do the underwater hydrotherapy, the underwater jogging? She has a ball where they can stretch out, acupuncture, acupressure. She does it all.
Yeah.
Now, as a veterinarian that's a surgeon, how important do you think physical rehabilitation is, and do you think If you were going back to school right now, would it be a specialty you would consider?
Oh yeah, I think it's very important, and it's a little more difficult in animals versus
You would think
people.
so.
It's nowhere near as controlled. It's you know, you can't tell an animal don't play tennis, but we're going to go through this range of motion with you, and it's a tougher field of.
So when someone brings their dog or their cat here, okay, it's a specialty situation, and you're doing a surgery, for example, then if you were going to a conventional veterinarian, private practice veterinarian, and they did surgery, let's say, for example, on your dog's hip, they might, great surgery, great job, and they might say, take the dog home and exercise him. Take it from a behaviorist. Those people are not going to take that dog home and exercise them. So once they get involved, and that's why I'm such a big fan of the physical rehabilitation, once they realize it's there, once they see that it can be done, but yet it's a field that no one knows about, and that's so impressed me with ASG, is the concept that you guys are like the first ones I know of to actually have a full-time, and I know that you know, in vet school right now, they offer it, but you have a full-time veterinarian that specializes in nothing. So I guess as a surgeon working closely with a physical rehabilitator really makes all the difference in the world.
Yeah, it is. It's very complementary to what we do, so it's nice.
So you've been here for 22 years. There's nothing you would change.
Oh yeah.
Other than your desk.
I would get a much bigger building, and we're out of room.
Well, let me brag. You're not going to say it about yourself, but let me brag a little bit about ASG. This is like several times I've been here now, and I spend a lot of time at the largest animals, the AMC in New York City, and specialty hospitals in Europe when I was going to the University of Frankfurt. And the bottom line is this: no matter how good the doctor is, no matter how good the hospital is, we were talking about this with some of the other vets earlier, I don't think there's a more anxiety-ridden time for a pet guardian than coming to an animal hospital with their dog or their cat. Because when even if it's for general, their regular vaccines, it's still yet when you walk in here, there's no stress, there's no anxiety. Coffee machine, which helped me. But more importantly is that I noticed the staff, and that comes from you down. And I don't mean to blow your ego out, but that does. It comes from you down. When you walk in here, the staff is smiling. The first thing they said to me is, "Warren, what can we do?" And then I sat there for a while because my cameraman was late as usual. So I sat there for a while, and as I'm sitting around, first of all, watching someone down on their hands and knees, scrubbing every part of that room. That's number one. Number two is all these people were coming out in white coats. All these vets were coming out to talk to the clients individually and say, you know what, this is what's going on. And you see the people walking out of here, even if there was a bad diagnosis, you see the people walking out of here knowing that they're getting the best that's available. Nothing better can be done than what they're getting here. And I so appreciate that as, you know, as a dog guardian for as many years as I've been, and working with the thousands of people I work with on a weekly basis. I would honestly say that if every veterinary hospital had the feeling of entering a place that's not bad, but a place that's going to make your pet feel better. What made you, I mean, how do you do it? I mean, you know, I have a business too, but how do you keep everyone so happy? I'm sure they're not happy all the time, but I mean, at least to the clients, they don't take any, they could have the worst day in the world.
Everyone knows it's a potentially stressful situation, and you've got to just be at your best, and you've got to just look after what is best for the pet and for the owner or the guardian, and just try to make it as pleasant as possible and try to ease that stress, because there, you know, it's almost like your kid. You come in and you're scared about what can happen, and so there's a lot of that going on. And everyone, we've got doctors that are training. We train doctors.
I was just going to ask you about that. I noticed you have interns down there. One of the things we were talking about is, you know, years ago, to be a veterinarian, you go to 4 years of vet school, you go to 4 years of regular college, and then you go out and you open a practice, or you work for someone for a while.
And we go an additional 4.
I was just going to say, now you have I was speaking to someone downstairs, a Justin Wakayama, I think his name is,
Yeah.
who had, this is his second internship, so he had 8 years of school. Now he has 2 internships, then he's going to residency. It's like a lot of years before he goes out there and earns a buck, a big buck anyway. So the bottom line is, when people think of veterinarians, they think, oh, doctors making a fortune, but there's a lot of schooling, more schooling than average, the general human physician.
Yeah. There's a lot of schooling, and we do the same as a human physician. And people don't realize the expense that goes into treating a pet, because we have nurses there 24/7. These are people that are working with all the animals in here around the clock.
Just the equipment I saw downstairs, the MRIs, the oxygen, it's just absolutely in shock to me how much is involved here. And yet,
the equipment is very expensive, and there's upkeep on the equipment. We just had to replace the tube on our CAT scan machine. Those things are several thousands of dollars, and people don't understand that, don't realize that we've still got to do that. And the employee cost is high, very high.
Now, do veterinarians have to deal with the same type of insurance if there's a malpractice type of thing? I know
we do,
years,
but it's nowhere near the cost of human medicine.
And first of all, anyone who comes in here with their dog or their cat, I don't want to get emotional about it, but I deal with so many different veterinarians, but I also deal with the people. The people that call me on the radio show are people that either had a great experience with their veterinarian, or a lousy experience with their veterinarian, or no experience with their veterinarian whatsoever. And what I often find, and this is why I'm such a stickler on bedside manner, is that there are more dogs and cats that probably could benefit from proper veterinary care if they would go to a veterinarian that the people felt comfortable walking in there. And I think one of the biggest mistakes, problems I see, and I get this on the radio, I get this all the time, my dog's been sick for like 3 months now, and I just don't want to go to my vet. What do I do? Well, you come here, it's what you do, if it's an emergency. So I'm really impressed by that. I'm really impressed by this whole thing. So you would say to me, as a veterinary specialty hospital, that pretty much not only do you go to school and get the education, but you guys have to really keep up. It's not, okay, now I'm a surgeon. Now I've done my schooling, I've got it all done, and I know everything there is to know. And this pin goes there, and that cartilage goes there. I know it all.
No. It's ongoing. Things are changing constantly.
Give me this knee for a second. Show me this for a second.
The knee, here's the elbow. These are all things.
Okay, so years ago, if a dog had a hip dysplasia or a bad bone, what was done other than?
Well, quite a while ago, things were treated a lot different, where dogs were put to sleep for hip dysplasia. It's a very treatable disease, very treatable at all stages, and dogs can do well at all stages.
So in other words, if a dog is diagnosed with hip dysplasia, no matter what stage it is, there's always something that can be done. Even hip replacement?
Yeah, hip replacements are done commonly, and dogs do well.
And this type of?
Well, this is an elbow replacement. This is a prototype that I developed, and is being worked on or produced by a company in Switzerland.
And what about artificial limbs now?
Yeah, there are different types of limb salvage, artificial limbs. Those are also very early in the stages of development.
But if your dog, for example, needed this type of surgery or the type of surgery, a replacement hip, at that point, is it something you'd want a general practitioner to do, or is it at the point where you say, time to go to an orthopedist?
No, there's only one person in the world that's done these.
So they have no choice but to go to you.
But yeah, no, hip replacements, there's several people that do them, but most all are boarded surgeons. I know a couple that aren't, and they do orthopedics. They're not boarded, but they have trained in it. It's a procedure that you need to do a lot of, and really study it and know the ins and the outs, and it's not just sticking an implant in.
So you actually do some teaching here too, though. So for example,
Oh, yeah.
a lot of your students that may come here that may want to go on to orthopedic surgery, I mean, they're learning from someone who's an orthopedic surgeon.
Yeah, we have residents and interns. They have to write papers, publish, and that's part of their requirement to get through. So we do things like this where they're writing papers on them. Hip replacements, actually published 2 papers in the veterinary surgery on hip replacements.
On hip replacement.
Yeah.
So that's becoming more and more common as well.
Oh yeah, it's very common. Yeah, hip replacements are. Elbow, that's a
so
new
much,
thing.
Not so much.
Yeah.
Now, what would require an elbow replacement?
Well, we see lots and lots of dogs that have had elbow dysplasia with severe arthritis in their elbows, and so it's quite common.
And it's painful,
Quite
so
common.
this would
Very
alleviate
painful.
the pain.
Yeah, it's a quality of life thing, and it's a very difficult joint. So it's something where there's a couple of people that have worked on them. I happen to be one of them. So.
All right, so all that aside, we've talked about all the specialties here and how I really like this place because of the bedside manner. If you were to describe the Animal Specialty Group to me, what are you most proud of?
Let's see. I'm very proud of the way our staff tries to treat people. I'm very proud of our doctors trying to be the best at what they do. And, you know, teaching. We've got a great internship program and residency program. I went through the same thing 20-something years ago. And I was at a university, and I think we're every bit as good or better than what's
being taught there,
yeah.
really. That's exciting. So in other words, you're at this stage of your career, this stage of your life, so besides that you're still doing surgery, but your main focus is really trying to bring that next generation into what's needed.
Yeah.
What do you see for the future in veterinary medicine? A lot of improvements?
Oh yeah, yeah. Technology is just going crazy, and this is all new. There are things that are coming out every day, and you know, we look at what we can do diagnostically. It's just leaps and bounds ahead of what we did when I got out of school.
So actually nowadays we have the ability not only to just extend life, but actually extend a quality of life.
Sure. Yep. Yep.
That's what I think most proud of, that quality of life that these dogs and cats get.
And we look back and we look at our patients and we say, wow, you know, it's really nice to see that. We've got people that come back and, you know, visit us, and it's
I was
really
looking
nice.
at the wall down, and the compliments and the people. I know from the radio show, for example, there are people that someone called me up last week on the radio show and said, thank you for sending me to ASJ.
Yeah.
You know, and when I get a call like that, to me, it says, okay, number one, I'm doing the right thing, but more important to me is that I'm very funny about it, you know that, and Brad will tell you too, is that when I find somebody that has the passion for their profession that I have for mine. I mean, I work 112 hours a week. I love the behavior. I could never do what you're doing. I have an abstract mind. I don't have a statistical mind, which is necessary for what you do. But I'm also impressed by the concept of more and more veterinarians working with people in my field, behavior, even certified veterinary behavior. I'm doing some work now with Tufts University with their head behaviorist over there, and it's interesting that behavior is now becoming a really important field as well.
Yeah.
So people are understanding it.
Another area where I go,
you don't want to deal with the dog
send you
peeing on the floor, huh? That's my job. You fix the
No.
bones, I'll fix the dog peeing on the floor.
Yep, yep.
It has been great, Dr. Wendelberg. So I spent the day at the Animal Specialty Group in Los Angeles, California. What an incredible day it's been. Right now you can see I'm in the operating room. A lot of things going on, just like a human hospital. The thing that impressed me most about ASG is the concept that I had the opportunity to interview internists, residents, the head doctors, surgeons, people that specialize in different types of medicine. And that's what veterinary care is all about. animal specialty group here in Southern California, and there are other specialty hospitals around the country as well. And I think that we're very lucky to know that our pets are going to get the quality care and live the quality of life now that these type of specialties are available to all pet guardians. And I just want to leave everyone with this. If you're going to your regular veterinarian, fabulous guy, great doctor, but you're not getting the results, that's a good time to say, hey doc, maybe we should see a specialist. Chances are he'll refer you to a veterinary specialty hospital exactly like Animal Specialty Group here in Los Angeles. And that's what it's all about, quality of life for all of our pets. They deserve it, and you know they do.